Welcome everyone, our audience in the hall, and everybody watching online. We are excited to present Bridging Medicine and Music Colon Cancer Awareness 2024. I am Dr. Ronald Su, Governor for Northern California of the American College of Gastroenterology, and a physician specialized in digestive health.
Hello everybody, welcome to the Mark Wood Rock Orchestra Experience. My name is Angelo Marino and I'm the proud orchestra director of Davis Senior High School and Holmes Junior High here in Davis, California.
Bridging Medicine and Music is an initiative that started in 2022 during the COVID pandemic. We wanted to reopen the curtain for in-person attendance for music concerts and medical conferences. To do this, I collaborated with Angelo and our violin mentor, Michael Sand, the director of UC Davis Baroque Ensemble, and created the inaugural colon cancer prevention seminar and concert. This brought together the two worlds of physicians and musicians in a showcase of the power of healing in both disciplines.
Tonight's performance would not be possible without the great support of the Davis Joint Unified School District and our wonderful music program. As well, our DHS Holmes Orchestra boosters and all the music teachers who have contributed to making tonight's performance happen. I also want to thank all the wonderful musicians, the students who have learned all this music and brought it to the concert stage for our audience to enjoy. And I would especially like to thank Ron Su and the ACG for all of their support in promoting tonight's event.
I'm grateful to the American College of Gastroenterology, our president, Dr. Jonathan Layton, Vice President of Communication Ann Lewis, ACG trustees, staff, and physician educators for educating us tonight on the importance of colon cancer prevention. I also thank Angelo and the music teachers and the young musicians from the Davis Joint School District for making the program so exciting and enjoyable. Most importantly, we all want to say a big thank you to our guest of honor, Trans-Siberian Orchestra's original string master, world-renowned electric violinist, Mark Wood, and Laura Cray, the rock vocalist, for bringing the rock and roll spirit to today's program.
And with that, everybody, I welcome you to sit back and relax and enjoy this rock orchestra extravaganza from Davis, California.
Now let me introduce the president of the American College of Gastroenterology, Dr. Jonathan Layton.
I am Dr. Jonathan Layton, president of the American College of Gastroenterology and professor of medicine at the Mayo Clinic in Arizona. I congratulate Dr. Ronald Su, American College of Gastroenterology's governor for Northern California, for his commitment and creativity in organizing today's concert and program. The college recognizes the great work of all musicians and experts who are participating in bridging medicine and music. As gastroenterologists, doctors who specialize in the digestive tract and the colon, our organization is committed to spreading the word that colorectal cancer is one of the most preventable types of cancer. With screening, your gastroenterologist can diagnose colorectal cancer at an earlier stage, find colon polyps early so they can be safely removed, and help to prevent colorectal cancer. Now, when should you start colorectal cancer screening? Experts from the American College of Gastroenterology say 45 is the new 50. Age 45 is the time to start screening for colorectal cancer among all average risk adults according to the ACG guidelines from 2021. This is an important change from early guidelines that used to recommend starting at age 50 for most people. So remember, 45 is the new 50 to start screening for everyone at average risk for colorectal cancer. So the Bridging Medicine and Music program is so meaningful and creative. I salute Dr. Su for using the image of a bridge connecting music, medicine, and well-being for both patients and physicians. We know music can help with stress and burnout. This unique program taps into the power of music to raise awareness of the importance of colorectal cancer screening in the entire community.
The American College of Gastroenterology is an international medical association comprising 18,000 medical professionals across 86 countries that focuses on advancing gastroenterology and improving patient care. Here are messages from the ACG leadership.
Hello, I'm Dr. Ronald Su. Today we are in Sacramento at the state capitol. We are doing a colon cancer awareness rally. The message we want to send out today is that colon cancer is preventable, beatable, and curable. Colon cancer is the third most common cancer in the United States. It remains as the second most common cause of cancer death.
These flags in front of you strung out in this portion represent the 5,530 Californians that are expected to die from colon cancer this year.
Educate yourselves. Help us. Volunteer. Even if you've never been affected, you can still be an advocate.
Every 10 minutes, there are 3 new cases and 1 death due to colon cancer in the United States. Each year, there are 150,000 new cases and 50,000 deaths. 1 in 25 women and 1 in 23 men develop colon cancer during their lifetimes.
Hello, I'm Dr. Nina Abraham, Director of the ACG Institute for Clinical Research and Education. Colorectal cancer affects both men and women and is the second most common cancer killer in the United States, but it doesn't need to be. If you're over the age of 45, talk to your gastroenterologist about getting screened. It could save your life. I've been screened for colon cancer. Have you?
Many have lost their loved ones from colon cancer.
Hello everyone, I'm Dr. Amy Oxentenko, President-elect of the American College of Gastroenterology. As you know, March is Colorectal Cancer Awareness Month, and so it represents a great opportunity for each of us to reflect on how colorectal cancer has had personal impact for each of us. So how has it impacted my life? Well, my father-in-law died at a relatively young age of colon cancer. So unfortunately, my children grew up not really knowing their grandfather Oxentenko in the way that I've been blessed to know him while he was still on this earth. So I would urge all of you, for those people around you that you love, your parents, your siblings, your children, your coworkers, your friends, really urge them to get up to date on colorectal cancer screening or surveillance, because that act of kindness and advice may be enough to save a life.
My name is Dr. David Rubin. I'm at the University of Chicago and I'm a gastroenterologist. One of the reasons I became a gastroenterologist is because the first person close to me who died was my grandpa Phil, and he died from colon cancer. And he died from colon cancer in an era before we had colonoscopies or knew how to prevent colon cancer. So I speak to you from the heart, and I speak to you as an expert, and I tell you how important it is to get screened and to prevent colon cancer. Get a colonoscopy, talk to your doctor, and talk to your family.
Hey everybody, Mark Wood here. I am so honored to perform a special concert with Maestro Angelo Morano, partnering with Dr. Ronald Su to share with everyone the importance of bringing music and medicine together and taking care of your health physically and emotionally, specifically colon cancer, which my grandfather and mother passed away from. First, I would love to share with you my history and work in the creative arts spanning over 50 years. Growing up in New York with a concert pianist mother and an abstract artist father, I had the perfect training ground for my creative adventures. My mother had 4 boys and she was determined to have a string quartet in our family. We were the first all-brother string quartet in the world, and I loved all the classical music we performed. At 15 years old, I was mentored by the great Leonard Bernstein at Tanglewood. with the Boston Symphony. And then I received a full scholarship to the Juilliard School of Music. And then I heard the Beatles, Led Zeppelin, Eddie Van Halen, and rock and roll. And I loved all music, but my heart was sold on rock and roll. I built the first electric violin when I was just 12 years old and continued to innovate electric strings for the past 35 years. During that time, I also won an Emmy Award for composing music for the Olympics and had a successful film composing career. Then I was the original member and original string master of the Trans-Siberian Orchestra, and in a few years we sold over 10 million records. And I helped build that great band up into a huge success. Also around that time, I developed an important award-winning music outreach program for our music students called Electrify Your Symphony. For the last 25 years, we've been empowering the next generation with creative and emotional intelligence development in addition to mastering the music performance. But my life isn't just about music and touring. It's about the importance of healthy living. As I said, my grandfather and mother both died of colon cancer. Even with my busy daily schedules when it comes to taking care of our health and well-being, to prevent colon cancer, please get screened. My brothers and I regularly get screened and checked for colon cancer. Please get checked and maybe we can help save lives. I strongly recommend everyone to follow their doctor's recommendation to get colorectal cancer screening. Bridging medicine and music brings together experts from both disciplines to work for a common good. I am so honored to help spread this important message to the world.
3 in 4 colon cancer patients have no family history of colon cancer. Early onset colon cancer is rising.
Hello, I'm Asma Shaukat. Colon cancer in the young is on the rise. Individuals in their 20s, 30s, and 40s that have any symptoms such as rectal bleeding need to be promptly evaluated. And with family history of colon cancer, screening needs to be started much younger, in their 20s, 30s, or 40s.
By 2030, colon cancer will be the #1 cause of cancer death for adults under 50. American College of Gastroenterology has made it a priority to promote education, research, and advocacy to prevent colon cancer. Last week, American College of Gastroenterology President Jonathan Layton spoke at a rally in Washington, D.C. to highlight new screening recommendations and advocate for laws to expand access to screening.
I'm Dr. Dana Early, Chair of the ACG Board of Governors, and I'm a Professor of Medicine at Washington University in St. Louis, Missouri. The ACG Board of Governors has representatives across the country and internationally. We work to make sure that members of Congress and the federal government understand the importance of access to colorectal cancer screening. Every year, we visit Washington, D.C. to talk to legislators about colorectal cancer screening and how they can support efforts to screen more Americans. ACG was a pioneer in lobbying for the law that established colorectal cancer screening as a benefit for Medicare patients way back in 1998. So we've been in the fight for a long time. We know that colorectal cancer screening is a powerful way to reduce cancer deaths and cases. The American College of Gastroenterology and its Board of Governors are committed to making sure there's access to colorectal cancer screening tests across the country. Congratulations to Dr. Sue and everyone involved in today's concert and program. You are doing important work and the American College of Gastroenterology applauds you.
As the Vice Chair and Governor of New Jersey, I have seen the impact that advocacy has on the national and the state level, and taking the message of colon cancer screening to the government helps improve our patients' lives. I also believe that advocating for oneself is essential. So when it comes to your health and the health of your family and friends, make sure that you talk to your doctor about colon cancer screening and be an advocate for your family as well as for your friends and above all, for yourself. Thank you, Dr. Sue, and thank you, Mr. Wood, for spreading this message on behalf of the American College of Gastroenterology. Thank you.
I'm Dr. Sunanda Kane, an inflammatory bowel disease specialist and professor of medicine at Mayo Clinic in Rochester, Minnesota. Patients with colitis longer than 10 years need to be screened for cancer sooner.
Patients with inflammatory bowel disease require special attention in regards to colon cancer prevention.
From the endoscopy suite to the stage, let's get the message out. Colorectal cancer is preventable and treatable. Hi, this is Kostas Kafalis, the treasurer of the American College of Gastroenterology and the drummer of the ACG band The Beacons.
Hey y'all, this is Pat Young, professor of medicine, trustee for the American College of Gastroenterology, bassist and singer for the ACG's official band, The Beacons. And while I love playing music, I don't like playing with my health. Did you know that colorectal cancer is on the rise in the young, and yet it is among the most preventable, treatable, and beatable cancers out there? So if you're 45 years or older and you have not yet been screened, do yourself a favor. See your doctor today.
Music has a unique way of bringing us together. I want to thank Dr. Ronald Sue for putting this program together and asking the Beacons to leave a message for all of you. I'm Samir Shah, past president of the American College of Gastroenterology and the lead cowbell player for the Beacons, along with some vocals. If you have inflammatory bowel disease, you're at higher risk for colon cancer, so it's important that you talk to your doctor about getting screened. After about 8 years of disease, you need to make sure you're getting your surveillance colonoscopies, hopefully with a high-definition scope, and chromal endoscopy, either virtual or dye spray.
I'm Benjamin Levy, a gastroenterologist at the University of Chicago. I also serve on the American College of Gastroenterology's PR committee, and I'm in charge of a concert for Colon Cancer Awareness Month. I'm super excited about this concert that we have. They're bridging the two and using music to teach the public about colon cancer screenings.
Hi, I'm Dr. Anita Afzali, Chair of the American College of Gastroenterology Educational Affairs Committee and Professor of Medicine at the University of Cincinnati. Did you know that 1 in 3 adults between the ages of 45 and 75 years old are eligible for colorectal cancer screening but are not getting screened? That means that over 20 million Americans who are eligible are not getting screened for colorectal cancer. Remember, colon cancer screening saves lives. Please educate yourself, get screened, and encourage others to get screened. Together, we can fight colorectal cancer and increase awareness.
Hey, I'm Doug Rex from Indiana University. I am a past president of the American College of Gastroenterology and the American Society for Gastrointestinal Endoscopy, and my favorite month of the year is March, because March is Colorectal Cancer Awareness Month, and we in gastroenterology are all about the prevention of colorectal cancer. I am all about colonoscopy, colorectal cancer screening, and colorectal cancer prevention.
Early detection of colon cancer allows easier treatments and higher survival rates.
Hi everybody, I'm Dr. Neil Stolman and I'm a working gastroenterologist in Oakland, California, and I'm also a trustee of the American College of Gastroenterology. I'd like to first of all thank you guys for coming tonight, but most importantly what I'd like to do is to encourage all of you to attend to this issue of colon cancer. I do this every day. I have heard every excuse in the book why someone doesn't want their exam, doesn't want their colonoscopy. They do fine, it is painless, it is easy, and it saves lives. And if any of you have any trepidation at all, part of tonight's event is to convince you to get over that and get screened.
When we live to 45, our colons will need to get certified, and we don't want to be just a face in the crowd. We're gonna check our colons and shout it out loud. It's our life, life that we treasure. Consider this some good peer pressure. We just wanna live when we're alive. Oh, it's our life. The colon is a living highway. No cancer should get in our way. We just gotta keep living and chasing our dreams. Please get screened. Never feel shy when they're calling you out. Don't bend, don't break, baby, don't break down. It's alive, it's now or never. 'Cause this here is the life we treasure. We just wanna keep living and chasing a dream. It's alive, the colon is a living highway. No cancer should get in our way. We just wanna live and chase the dream. Please get screened. It's alive, the colon is a living highway. No cancer should get in our way. We just wanna live